As I said, I'm coming from Wurundjeri land, and I would like to pay my respects to elders past, present, and emerging. Now, Soph, thank you for joining us. Welcome. How are you?
I'm wonderful. We are living in a wonderful time. The sun is shining, the birds are singing, the world is beautiful. We've got Freestyle Libre 2 on the NGSS. We released a statement about all people with type 1 diabetes having access to diabetes management technologies. We've got a statement, terrific. We've got a statement in the MJA today or this week about in-hospital management of diabetes and the fact that we can do better.
Yes,
we must do better. So it's wonderful. It's a wonderful time.
All happening for you. You are standing there, or sitting there, I should say, with a background that says ADC, and I know that that stands for the Australian Diabetes Congress. So you've got a bit of a busy week next week, don't you?
So the next week is our premier conference and educational activity from August 11th to the 13th, and all of us will be there, including you, including me. Have you registered? I've registered. You've registered.
Oh yeah, I going to follow that up as soon as we finish this chat. I will follow that up. So the Australian Diabetes Congress is a health professional conference, I should say, that's on next week. I'm going so that and when I say going, I will be in this room because it is a virtual conference, and I will be there reporting back. So the stuff makes sense to people like me because I'm not a health professional. Now, so today we are talking all about COVID-19 vaccinations, specifically for people with diabetes. And I would just like to say before we get down to it, because I have got a bucket load of questions for you, to everybody who's watching, thank you so much for joining us. I would also like to say, we know that you're going to hear us saying a lot of time, please go get vaccinated, please go get vaccinated. We know that it's not that easy because there are some shortages. So when we're saying please go get vaccinated, we do understand that, and we're very, very, we know that that is clear. We're very excited to have heard this week that 12-year-olds with diabetes are now eligible under phase 1B, and that means that you can go and have a chat with your health professional right now to get 12-year-olds and older with diabetes vaccinated. So that was a really great announcement, wasn't it, Sol?
It's terrific. I think it's really, really good. It's a positive step that kids 12 years and over and adults with diabetes can go and get will be prioritized to get vaccinated. And the 12 to 15, I think, comes into effect from August the 9th.
Right.
So go and have a chat to your health professional, your GP, your endo, if you're seeing them, and please do so. Please go and get vaccinated.
Absolutely. And you're being joined today, for everybody who's watching, both Soph and I have been double vaxxed. We're both fully vaxxed. I was vaccinated with Astrazeneca. I got my first jab the week that people with diabetes were eligible. So it was actually back at the end of March that I got mine. And then I got my second one 12 weeks later. So I'm very happy to have a vaccination certificate on my phone. And you've also been double vaxxed, haven't you?
Yes, I got vaccinated straight away as soon as my age group, because I'm above, I don't want to say, but I'm above 50. I'm not saying above 50, 52 actually. I got vaccinated. My first AstraZeneca was on May the 3rd. On the Monday, I went straight away. And then my second was last Monday, July the 26th. I feel terrific. I feel wonderful. I feel that I'm doing something positive, not only for me, but for my family, for my mum in particular.
Yes.
Because I want to protect her. She's also gone and got the AstraZeneca vaccine.
Yeah, mine too. My parents have too. Yep. My parents and my in-laws have both been fully vaxxed with AstraZeneca, and my husband got Pfizer, as did my sister. And so we're just encouraging everybody to have their vaccine. But we know that there are some people out there who might have some hesitancy around that. So that's what we're really here to do today, is to address that. if anybody is watching and has a question, please share it in the comments and we will see that and we will try to get to answering it. If you've got a question and you would not like your name and you don't want actually to be in the comments, if you send a direct message to Diabetes Australia on Facebook, we will see the question there and we will ask it without identifying, you won't have shared your name on the comment in the public comments section. So we want to answer every question we possibly can. But let's talk about this. Yeah.
And that's fine. And it's fine to be a little bit hesitant, and it's fine to sort of have a think about it. That's absolutely normal and absolutely fine. And we can talk about it. Let's talk about what is it that's troubling you a little bit? What is that slight hesitancy, particularly if you've got diabetes? And we know that people with diabetes, whether you're a child or an adult, having diabetes doesn't increase your risk of being infected.
Yes.
With any virus, including the COVID-19 causing virus. But having diabetes, if you get an illness, any illness, it obviously makes it slightly more challenging to manage your blood glucose levels, to then have a sick day management plan.
Yeah.
You must have a sick day management plan.
Yeah, and we'll talk about who you need to talk to for that in a minute. But you're absolutely right. That was, I guess, the message that Diabetes Australia from the very beginning, that we were making sure it was really clear. You're not at a higher risk of getting COVID, but if you do, the complications from it and the recovery time and managing diabetes with a really nasty virus, let's do everything possible to avoid it. So beforehand, we had things like making sure that we're washing our hands and keeping distance and staying home and wearing masks. We've still got to do all of that, but we've suddenly got this extra bit of protection, and that's vaccine. So it's adding to our list of ways that we're protecting ourselves and we're protecting others, and that's super important, isn't it?
That's right. And we know that if you're fully vaccinated, particularly, then your risk of falling really, really sick from COVID reduces drastically. Your risk of being hospitalized, it reduces drastically. There's 95, 98% protection from COVID, from the actual disease, if you're fully vaccinated. And that means you can manage your blood glucose levels better. You don't have to think about your 6-day management plan necessarily. You're hydrated, you're well fed, you don't feel yucky, all the things that may throw out your blood glucose management, which then increases your risk of DKA and all sorts of other things.
Okay, we've got a question coming. How safe is it for a 12-year-old with type 1 diabetes to be vaccinated with Pfizer?
So as far as we know, and as far as both the FDA in America and the TGA and ATAGI in Australia, it's safe. It's very, very safe. If your child is 12 years old and has diabetes, they're prioritized from August the 9th. And I recommend and suggest go and speak to your healthcare professional, go and speak to your GP or your endocrinologist or your diabetes educator and have a plan. And if it's suitable, then please go and get tested, go and get vaccinated.
Go and get vaccinated. So I think there's probably some real reassurance that we can feel in Australia, because we know that TGA process has been so thorough, right? I mean, that's why I know that we saw places overseas sort of starting their vaccination rollout sooner. And unfortunately, ours didn't really start until the end of February. But part of that was because the TGA process was so robust. That means that we can be even more reassured, doesn't it?
Yes, absolutely. And not only reassured, but very certain that both the TGA and the ATAGI are so thorough, so very, very careful to ensure that any medication, any device that comes on the market, including the vaccine, is absolutely safe.
Yep. Okay, so somebody said, is it safe? So we'll talk about Pfizer, because for the under 18 age group, Pfizer is the only vaccine that has been approved for use.
Correct.
AstraZeneca is 18 plus. So let's just talk about, actually this one can be relevant for both. The question is it safe and proven to use with insulin?
Yes, absolutely.
Yeah.
There's no reason why you shouldn't. Just monitor your symptoms once you get the vaccine. To ensure that you're not feeling unwell, and make sure you're hydrated, make sure you're keeping up with your insulin, make sure you're eating appropriately. So because sometimes you do feel a little bit off with a vaccine. I know I didn't feel any side effects at all. My mum didn't feel any side effects at all. But other people have said, oh, I felt really lethargic and not well. So if you keep up, it's not the vaccine per se, but it's the effects that we're thinking about, and it's very safe to use with insulin. Yes.
Yeah, let's talk about those side effects. So I'm like you. I keep telling people that I didn't have any side effects, but actually I'm going to tell you what my side effects were. After both shots, I got 2 really good nights sleep, like the best night's sleep that I had in a long time. And also I had the next 48 hours after both of them, I was about 90 or 95%. In fact, one time I think it was 100%. My timing range, my glucose levels were between 4 and 8 the whole time. So it was like I was cured. Clearly not. But but what side effects? Because I have the flip side of that is I do know a couple of people who they did experience elevated glucose levels after they'd had their jabs. What are you hearing? Everything, right?
Look, I'm hearing that from nothing, like myself, to sweats and colds, to feeling achy and pains and really, really lethargic. Like the people just wanted to sleep. All I wanted to do was to sleep all day. I just felt I couldn't do anything. I just felt really off. So that's what I hear. And usually 24 hours, and then after that, they're recovering and feeling much better. So the side effects are actually quite transient and not as severe as opposed to getting COVID.
Of course.
Where
Absolutely.
you're zonked out for a long time.
Yeah, absolutely. And I think that that's really important that we understand it's perfectly normal to have side effects after a COVID vaccine, just as you might after a flu vax or I remember I've got my daughter's 16 now, but when she was a baby, I always remember we used to get told after their childhood immunizations, have some baby Panadol on hand. They might need it. They might be a bit grizzly. So that's perfectly normal, isn't it?
That's absolutely correct. That's perfectly normal, because what you're doing is you're making your immune system react so that if you come into contact with the virus at some point later on, your immune system is already ready to go to fight it.
Fantastic.
And that's what the vaccine is.
Yep. Good. So somebody's actually asked about how do people get priority access? My daughter is 14 with type 1. So I'll just quickly answer that. I think if you have a look at the eligibility tracker online and you put in all of the details, it will say that your daughter's eligible from the 9th, and then it will give you a list of places where you might be able to go. We'll put details like this in the comment section so that you can have a look, but also having a chat with your GP, because your GP might be able to help you where direct you if they don't actually have Pfizer, because I know not all GPs do, but they'll be able to direct you to where you can go. There's lots and lots of information out there, and I know that trying to navigate it all is really, really tricky, and I know that booking appointments can be really, really fraught as well. What I found, my experience was that I just threw everything I had at it until I found someone, and I was so desperate to get done as soon as I could. I made a lot of calls the day that I was first eligible to find somewhere, and did the same. Actually, my husband was working and it was my day off, so I sat on the phone until I could get him in somewhere. So I think that sometimes it can take a bit of effort.
It does. And I went for my first vaccine. I went to the Repat Hospital in Heidelberg. I waited for 5.5 hours, but I was determined to get it done. I really thought, this is really important for me, for the community, for my family to get done. With my second one, I booked online and turned up at the Sandown racecourse and got it done.
Yeah, absolutely. Fantastic. Okay, here's a question. This is one we're going to say you do need to go and have a chat with your own health professional, but I'll just ask it anyway, Soph. Is it safe to be vaccinated if you have had a history of heart issues, lung issues, as well as diabetes?
Now, as you said, I think this is when you have multiple chronic conditions, the best thing to do is to go and speak to your health professional. Go and speak to your GP who knows you well. Go and speak to your specialist who knows you and your history, and they will advise you for the best way forward. We can't tell you because we don't know you and we don't know your history. But your health professional, your GP, knows you and knows you well. And that's the first port of call. Your GP would be the first port of call for this situation.
Okay, great. We've just had a comment. Somebody said that the eligibility tracker locks you out once you put that you're 14 in there.
Yeah, I think probably because they haven't updated it. Yeah, they haven't updated it, and it's starting from August the 9th.
That's
so that's next week.
Yeah, keep an eye out. However, I would also suggest, you know, if you're in Vic, you ring the Victorian COVID hotline, New South Wales, and wherever you are, ring your local COVID hotline. And I know that you might be on hold for a while, but they may be able, they might have some updated information and even help you book in. So I have a question, because we've had a couple of people. So Diabetes Australia obviously has been making sure that we're keeping very up to date with the latest information and any news about vaccination. So as soon as we saw that children above 12 were part of the phase 1B rollout, we made sure that we added that. And we have had a couple of parents say they're not getting their kid vaccinated because their child was diagnosed with diabetes straight after one of their earlier vaccines, a childhood vaccine, whatever it may have been. And I can understand why people might be feeling anxious about that. But let's talk this through. Is there any evidence that any vaccines at all cause type 1 diabetes?
No, not that I know of, not that I can think of. I don't think that any vaccine, including the COVID vaccine, is associated with you getting type 1 diabetes. I should rephrase. Is the cause of you getting type 1 diabetes.
Yep. So what do we say when someone says, I was diagnosed, or my child was diagnosed the week after I had a measles, mumps, rubella shot?
Yeah.
Or polio, whatever.
Look, we know, and you know, and I know that you don't get diabetes. Sorry, you get the symptoms of diabetes from one day to the next.
Yeah.
But there's a buildup. There's a loss in your ability to produce and secrete insulin from your pancreas for a very long time. And then you hit the point, which I call the inflection point, where there's not enough insulin to regulate your blood glucose, and then you know things become quite acute quite quickly. But that loss of the ability to produce and secrete insulin occurs over months, maybe years.
Yeah.
So there's a long lag phase for diabetes, which you're not aware of because you've got no symptoms.
Yeah.
So I know sometimes there's an incident or something happens, or you get the flu and you get diabetes straight after that, or you get a vaccine or something, you get diabetes straight after it, and that could be sort of the trigger that sort of pushes it quicker. But there's a long time where you're losing beta cell.
To see that in a really great graph, I guess, if people Google natural history of type 1 diabetes, there is a graph that shows that, and it shows very clearly how the point where of diagnosis, it isn't something that happens overnight. It takes time. So I understand. The other thing I would just like to say, because I don't think we should ever minimize people's concerns about this, and we all want to blame something for our diabetes. I get that. I really wish I could say that's the reason I got it, because then I probably wouldn't blame myself, which I do sometimes. So I get it. But unfortunately, vaccines are not those things that you can blame. Or fortunately, that's not the thing you can blame.
No, unfortunately not. It's not you. It's not the vaccine. It's not because you had a donut or baklava, a sugary treat. It's not any of those reasons. It's multifactorial. There's a lot of causes, probably mostly genetic, predisposition, with environmental influences. We don't understand the genetics of type 1 or type 2 diabetes. But we do know that, if you do maintain a good lifestyle, you can manage both diseases and you can manage them well.
Now, this is a bit of a tricky one, but I do want to ask this because I've spoken with people who have said, the nurse or the doctor that I see has said that I shouldn't have I shouldn't get a vaccine, that I should wait, they're not safe yet. Now, unfortunately, we know that there are people in every possible, doing every possible job who might necessarily not be as science and evidence focused as we need to be. It's okay to go and seek a second opinion, isn't it?
Absolutely.
Yeah.
I tell people, like mechanics, doctors are doctors, and there's good doctors or nurses, and there's okay doctors. I'm not going to say that. It's like
There are
or
great
plumbers.
ones too, settle.
Yeah, great ones. It's like plumbers. There's really, really good plumbers, and then there's shonky plumbers.
Yeah.
So if you feel that you're not getting the right advice for anything, including the vaccine or the management of your diabetes, go and seek a second opinion. Go and see somebody else. All I can say to you is this, because I looked at this and I wanted to sort of give people a flavour of what's happening. In Australia, at the moment, we've got about 35,000 people that have contracted COVID.
Right. Yep.
Over since it started last year, and there've been 925 deaths.
Mm-hmm.
So that's 2,600 deaths per 100,000 cases.
Yep.
With the Astrazeneca vaccine, where we know about the blood clots, we've had 6.3 million AstraZeneca vaccines given to the 29th of July. This is data from the TGA website. And there's been 3.1 cases of thrombosis per 100,000.
Yes.
So if you get COVID, 2,600 deaths per 100,000 cases.
Yep.
If you get the AstraZeneca vaccine, it's 3.1 cases of blood clots per 100,000 vaccines. So you're 1,000 times more likely to die from COVID than to get a blood clot from the AstraZeneca vaccine.
Yeah.
And there's been 6 deaths associated with the blood clots, 5 of those to the TTS, but to the more common. 6 deaths out of 6 million.
Yeah. Which is
vaccines.
6 too many. We're not minimising that.
Not at all.
When you're looking at a risk profile.
We're talking about the risk. Any death is a terrible thing.
Yes, of course.
But you're looking at the risk of it. So, 925 deaths from 35,000 people who have contracted COVID in Australia. So I think the numbers are telling you that the vaccines are safe, as safe as they can be. Any drug, whichever drug you take, anything that you take has a risk profile. Insulin's got a risk profile.
Insulin sure does.
Right?
Absolutely.
But would you stop taking insulin because it's got a risk profile? No, because the benefit that you're getting far outweighs the risk.
Yeah, absolutely. I think that's really important. That's probably really hard for everybody to sort of take in with numbers being thrown at you. But if you do search, there's some really good data, easy to understand and not too much and not too full on, so that you can actually see that. Okay, here's a question, Soph. Is there anything about type 1 diabetes and pregnancy in relation to the COVID vax?
So the TGA and ATAGI do recommend that if you are planning pregnancy, if you are pregnant, or if you are breastfeeding, to get the Pfizer vaccine in preference. It is safe. There has been no adverse event in pregnancy or breastfeeding and the Pfizer vaccine.
Absolutely. And if people are wanting to read up a bit more about that, and this isn't just in Australia though, but Dr. Jen Gunter, who is an obstetrician and a gynecologist in San Francisco, actually has written some really accessible pieces about this. She's all evidence-based. She spends all of her time really, when she's not talking about the science stuff of getting a COVID vax at the moment, she spends a lot of time shouting down people with their natural remedies that can cure everything from diabetes to grey hair. So go and have a look at her. It's Dr. Jen Gunter. You'll be able to find her. I think her I think her blog is called The Vagenda. So go and find her. She's very good.
But I think it's an important point with pregnancy, because I know that is you want to do the best that you possibly can for yourself and for your baby during that time. And I think the best thing that you can do is to get vaccinated, particularly if you've got the ability to do so with the Pfizer vaccine.
Yep, and have a chat with your obstetrician, of course, because they will, I'm sure, say exactly what Sopha's just said. But it's good to hear it from lots of different angles, I think. So let's talk about glucose management after a COVID vax, because as I mentioned earlier, I do know a couple of people who have said that their blood sugars have run a bit high. I know some people have said their blood sugars have run a bit low. And then we've got me, whose blood sugars just were beautiful for 48 hours afterwards. I don't know. So clearly we can't say this is going to happen, because as with everything with diabetes, your diabetes may vary. So what sort of things can people be doing to help, to really focus on making sure that they're keeping things in check? And is there a point where they should think, actually, I probably might need to have a chat with a healthcare professional about this?
Yeah, I think after you get the vaccine, just make sure you're testing. You're measuring your blood glucose maybe a little bit more frequently. If you've got a CGM or a flash, make sure that you get the readings a little bit more frequently and have a look. If you're worried, if they're trending upwards and you're worried, ensure that your pump's working okay, or your insulin dosing is appropriate. Make sure it's okay. And if you've got any concerns, go and see your CDE, go and see your endocrinologist, your healthcare professional, to make sure that there's nothing else untoward occurring at the same time as a coincidence.
Yeah, okay, good.
But, people are different. It's an individualized kind of thing. You didn't react at all to the vaccine. Somebody else may have skipped a meal or eaten a bit too much or eaten less because they didn't feel okay, and that may have changed their blood glucose management, and hence it's gone off a little bit. Please take your insulin. Please try and avoid DK. Please stay hydrated. Please test, and maybe test a little bit more frequently, just for the next 2 or 3 days after a vaccine.
Absolutely. Great advice. Now, here's a really good question. We've got questions coming in everywhere. Annie wants to know, what's the difference between Pfizer and Astrazeneca for people with diabetes? Is there one that's safer over the other? So we'll talk about over 18s, where you've got a choice of having, or you don't necessarily have a choice, but that both are available to people over 18. Is one more? Is there one that's better for people with diabetes? One that's safer? Or
no. They are both extremely effective and safe for everybody, including people with diabetes. We haven't seen any difference between, and I don't think they'll do it. That they'll compare one with the other, because they're both extremely safe and efficacious against COVID. So either, if you're over 18 and there's no other underlying health issue, get either vaccine, whichever vaccine you feel comfortable with and your health professional is happy to advise. Get either vaccine. They're both safe.
Okay, wonderful, fantastic. Now, this is a really good one. I like this one. Oh gosh, this is going to test you. I have type 1 diabetes, fully vaccinated with Astra, no issues. But the question is this person getting the same level of protection as people who don't have diabetes, who have also had their 2 doses of whatever?
Yes.
Yes.
Yeah, absolutely. Yeah. So whether you've got diabetes or you don't have diabetes, the protection that you're going to get from the vaccine is the same. Your immune system responds. You've got antibodies now. If you get exposed to COVID, you are in an outstanding position to be able to fight it and fight it effectively, and you won't get sick. So yes, whether you have or you don't have diabetes, that doesn't mean that the vaccine is any less protective.
Okay.
For you. So that's why we tell people, go and get vaccinated. If you have the opportunity and you can, and you're eligible, and there's nothing else that prevents you from doing so, please go and get vaccinated. For your mum and your dad, for your children, for your family, for your
Yep.
brothers and your sisters. Get vaccinated.
Yeah. And remember, as Brett Sutton, our Chief Health Officer in Victoria, who we all adore, keeps saying, the best vaccine is the one that you can get. So go and get one. So I think that's really good. Okay, here's a really good question. Somebody's asked that, so their child is booked for Saturday, but they have a cold. It's just a cold. Everyone's got a cold. It's wintertime. It was hard to get the appointment because Pfizer appointments are hard to come by, and they're in a rural area, and all of the rural vaccines in Sydney have been redirected to Sydney. But they want to know, with a cold, can you still go and have your vaccine?
Look, my advice to you is to go and have a quick chat with your GP.
Yep.
And see what the GP recommends. It may very well be okay, but I think you should probably check with the GP to make sure, because when you're sick and you're feeling sick, you don't want to go out to infect other people, whether it's the cold or anything else, COVID or anything else. So you should probably ensure that you're feeling better. I know it's a hassle, because you have to make the appointment again, and but I think it's probably better for everybody that you get over the cold before you go and get vaccinated. But speak to your GP if you can. Give them a call. Have a chat over the phone. Telehealth is a wonderful thing.
It is
at the moment, and you can do telehealth consultations. Perfect.
Yep. Okay. So, so somebody here has said that their daughter has just recently diagnosed with type 1 and actually isn't yet on insulin. So that can happen. I know. Yes. So that's just something, very different for everybody. But in this instance, their daughter's not yet on insulin. She wants to know, could getting the vaccine expedite her need for insulin? So could the vaccine make her need to start taking insulin sooner?
No, I don't think so. And I don't think we've got any evidence that the vaccine would then accelerate the requirement for insulin. I don't think that would occur. Okay. I'm not quite, but I don't think, again, speak to your endocrinologist, your pediatric endocrinologist would be a lot more up to date with that kind of information, but I don't think so.
No, I haven't seen anything.
You haven't seen? Yeah, I don't think so.
No. Can kids with type 1 under 12 get vaccinated? No. Because
no, not yet. Sorry, we should qualify. Not at the moment. Not yet.
Not yet.
But there are studies that are being done from 6 months and above, and I think there's the expectation that by the end of the year or early next year, the recommendation again will change, and it will include kids under the age of 12.
Yeah, absolutely.
Because they're doing the studies as we speak.
Yeah. So I would just say to people, if your child with or without diabetes, or with diabetes specifically for this point though, keep an eye on the Diabetes Australia pages, because we update every time there's a new TGA announcement specific to diabetes. We will make sure that we announce the TGA announcement as well then as what happens to the vaccine rollout, because they can take a little bit of time to catch up with the TGA announcement. So keep an eye on Diabetes Australia. We're the source of all things vaccine. Makes me very happy.
And diabetes.
And diabetes. not just diabetes vaccines, because we're called Diabetes Australia. Good. Thank you for the reminder for that. Okay. Now, Tamara wants to know, are there any side effects that I should be concerned about as somebody with type 1 diabetes?
No, not any more than what we just discussed now. Okay. You may have no side effects like Renza, but you may have side effects like not feeling well, feeling really sort of lethargic and fluey and sickly, runny nose, or a bit headachy. That's transient. So I don't know. Get vaccinated. And you'll find out.
Yes. That's right. Now, we have answered. I'm going to just say two things. One, please, if you've got any, we're going to wrap up very shortly. So if you've got any questions, you better get them in now, because otherwise Soph will be gone, and then he's going to be very busy with the Congress next week. And the second thing I want to say is, if you have had a vaccine and you want to share your experience, you can do that in the comment section, because I know that learning from others, that peer support, and it's often incredibly reassuring hearing and seeing just how many people have had their vaccine. So feel free to share your story. Now, we have answered this, but someone's asked it again, so I'm going to ask again. Does having type 2 diabetes, let's say any type of diabetes, does that increase your risk of getting COVID?
The answer is no. Just because you have diabetes, whether it's type 2 or type 1 diabetes, you are not at a higher risk of getting COVID or any other virus like the flu, for example. But as we said before, we recommend everybody to get vaccinated. We recommend everybody to get vaccinated against the flu, as you know, every year. Diabetes Australia does a really good campaign for the flu vaccine.
We do.
And we are recommending everybody to get vaccinated against COVID because it's the symptoms that we're worried about more so.
Yep, absolutely.
Throwing your blood glucose management out.
Yep, absolutely. Now, should all family members have the vaccine if there is somebody with type 1 or type 2, for that matter, I guess, in the family?
Yes, please. And I think because then you're all protected.
Yes.
And you know, if there's one member, and we've seen it where one member is on the news, where one member is vaccinated, the other person isn't. And the person that is vaccinated has little to no symptoms, and the unvaccinated person gets a lot of side effects from COVID. You know, gets really sick from COVID. So I think if you can, the whole family should get vaccinated. That way,
everyone's protected.
You don't have to think about it. You're protected. You're vaccinated. You're protected, and everybody's all good to go. So you don't have to think about it that way. That's the way that I say it.
We should just be clear about that, because as everyone knows, or might not, but I have type 1 diabetes. My husband is vaccinated because he, once vaccines were available to people over 40, he was able to get it. But our 16-year-old can't, because that age group isn't part of the current rollout. So yes, we are saying that everyone in the family should get vaccinated, but you may not all be there yet in terms of what the rollout is. So that's something to remember that.
Yeah, of eligibility. And we just got to be mindful of the eligibility. Now, if you're not eligible, it doesn't mean that the vaccine isn't safe for you. It just means that we don't have the information or the studies to support that age group. For example, you know how we've said under the age of 12, and if you've got type 1 diabetes under the age of 12, it's not recommended. It's not because it's going to be harmful. We don't have the data yet.
That's right.
That can be scrutinized. Just wanted to make that clear.
They are starting to vaccinate children overseas. I know in the US, I think it could be 4 and over now that they're doing. So we will get there. It's, you know, we will absolutely get there. So, all right. So I could talk vaccines with you all day, but I know you have work to do, and I do as well. Thank you so much. Thank you for being so wonderfully open to having this conversation and for answering everybody's questions.
I want to thank you, and I want to thank everybody who asked questions and who's curious. Please go and get vaccinated if you can, and if you're able to. I think that's the sort of take-home message. It's safe. Whether you have type 1 or type 2 diabetes, it's safe. If you can, please go and get vaccinated. If you're unsure, speak to your health professional, speak to your GP, speak to your endocrinologist, your diabetes educator for more advice.
Absolutely. Wonderful. That is such great advice to end on. Thank you to everybody who has watched and come along. This will be up on our Facebook page. It will wind up on our YouTube channel as well. So please, you can watch it again or share it with people who may have missed. We need to get messaging out about why vaccines are so important in the broader community, especially in our diabetes community as well. So please feel free to share that. If you would like to share your story about getting vaccinated, send us a DM, and we would love to hear all about that. We're continually sharing stories because, as I said earlier, hearing about other people with diabetes and their experiences, and it's not just about the vaccine, but in this instance, we're talking about the COVID vax. But we know that that is often a really wonderful source of support. And I guess it alleviates a lot of concerns that people might have. So please do share your story with us. We would love to see that. But thank you so much to everybody. Stay safe. If you're in lockdown, I know how tough it is being in Victoria. We might be heading back there soon, but please, everybody, do stay safe and stay well. And if you can, please go and get vaccinated. Thanks to everybody. And I think we can end the broadcast now, Marie.